If you're over 60 and you've been waking up feeling exhausted, with a racing heart or that pounding sensation in your head, I need you to pay very close attention to what I'm about to share. Because the position you sleep in tonight, something you probably haven't thought about in decades, could be silently pushing your blood pressure into dangerous territory while you're completely unaware. And here's what really concerns me as a physician. Most people have no idea this is happening until they're sitting in my office after a health scare that could have been prevented. I'm Dr. Sophia Reynolds, and I've spent over 20 years as a cardiologist specializing in cardiovascular health for adults over 60. In my practice, I've seen thousands of patients who came to me confused about why their blood pressure medications weren't working as well as they should, or why they kept waking up feeling worse than when they went to bed. And time after time, when we dug deeper into their daily habits, we discovered that something as simple as how they positioned their body during sleep was working against everything else we were trying to accomplish. Before we dive into this critical information, if you haven't subscribed to this channel yet, I really encourage you to hit that subscribe button and tap the notification bell so you never miss another health tip made especially for you. And if you find this video helpful, please leave your suggestions and questions in the comments below. I read every single one, and your feedback helps me create more videos to help more people just like you. Now, let me tell you about Margaret, a 72-year-old retired school teacher from Portland, Oregon. Margaret came to see me last spring, and she was frustrated beyond words. She'd been taking her blood pressure medication faithfully for 8 years, watching her sodium intake, walking 30 minutes every day, doing everything right. Yet her morning blood pressure readings were consistently elevated, sometimes dangerously so. Her previous doctor had already increased her medication twice, and she was worried about adding yet another pill to her daily routine. When I asked Margaret about her sleep habits, she mentioned almost as an afterthought that she'd been sleeping on her stomach for as long as she could remember. It was the only way she felt comfortable falling asleep. What Margaret didn't realize was that this seemingly innocent preference was creating a perfect storm inside her body every single night. Her stomach sleeping position was compressing her chest, restricting her breathing, and forcing her heart to work harder for 7 to 8 hours straight. No wonder her morning readings were through the roof. Within 6 weeks of changing her sleep position, Margaret's morning blood pressure dropped by 15 points on average. She actually called my office in tears, saying she finally felt like she had some control over her health again. And that's exactly why I'm making this video today. Because I believe you deserve to know what Margaret learned, and I don't want you to have to wait years or go through a health scare to discover it. Let me start with the sleeping positions that could be sabotaging your cardiovascular health, and I want you to really think about whether any of these sound familiar. The first position I need to warn you about is sleeping flat on your back without any elevation. Now, I know this might surprise some of you because we've all heard that sleeping on your back is supposed to be good for your spine. And that's true to some extent. But here's what happens inside your body when you lie completely flat, especially if you're over 60 or carrying any extra weight around your midsection. When you're flat on your back, gravity pulls everything in your abdominal cavity upward toward your chest. This puts pressure on your diaphragm, which is the main muscle you use to breathe. Your lungs can't expand as fully as they should, and your heart has to pump harder to circulate oxygen through your body. Throughout the night, this creates a subtle but persistent stress on your cardiovascular system. I had a patient named Robert, an 81-year-old retired firefighter from Chicago, who had been sleeping flat on his back his entire adult life. Robert was a proud man, very physically active for his age, still volunteering at community events and playing cards with his buddies twice a week. But he'd been dealing with high blood pressure for over a decade, and despite being incredibly disciplined with his medications and diet, his numbers just wouldn't stabilize. Robert's wife, Eleanor, mentioned during one of our appointments that he snored terribly and sometimes seemed to stop breathing for a few seconds at a time. That was my first clue. When we did a sleep study, we discovered that Robert had moderate sleep apnea, and his flat sleeping position was making it significantly worse. Every time he stopped breathing, even briefly, his body released stress hormones and his blood pressure spiked. This was happening dozens of times every night. We worked together on elevating the head of Robert's bed and training him to sleep in a slightly inclined position. The transformation was remarkable. His snoring decreased dramatically, his sleep apnea episodes were cut in half, and his blood pressure finally started responding to his medication the way it should. Eleanor told me she felt like she had her husband back because he wasn't exhausted and irritable all the time anymore. If you're still watching and finding this information useful, drop a comment below with a 1 just to let me know you're with me. It really helps me understand what topics matter most to you. The second dangerous sleeping position is one that might hit close to home for many of you, and that's sleeping on your right side. I can almost hear some of you saying, "But Dr. Reynolds, I've always slept on my right side and I'm fine." And I understand that reaction. But let me explain the science behind why this position can be problematic, especially as we age and especially if you already have blood pressure concerns. Your heart is positioned slightly to the left side of your chest. When you sleep on your right side, your heart essentially has to pump against gravity to send blood to the rest of your body. This might not seem like a big deal, and for young, healthy individuals, it usually isn't. But when you're over 60, when your blood vessels have lost some of their elasticity, when your heart has been working hard for decades, that extra effort adds up over the course of a night's sleep. There's also another factor that many people don't consider. Sleeping on your right side can affect something called your vagus nerve, which is a major nerve that helps regulate your heart rate and blood pressure. Some research suggests that right-side sleeping may stimulate this nerve in ways that aren't ideal for people with existing cardiovascular concerns. I remember a patient named Dorothy, a 68-year-old grandmother from San Antonio who worked part-time at a local bakery. Dorothy was one of the warmest people you'd ever meet, always bringing homemade cookies to her appointments, always asking about my family before we even discussed her health. She'd been managing her blood pressure reasonably well with medication, but she kept having these episodes where her heart would race at night, waking her up in a panic. Dorothy had been a right-side sleeper for 50 years. She told me her mother had always slept that way, and she'd just naturally adopted the same habit. When I explained the potential connection between her sleep position and her nighttime heart racing, she was skeptical at first. But she agreed to try sleeping on her left side for a month, just to see what would happen. The results spoke for themselves. Dorothy's nighttime episodes decreased from several times a week to maybe once or twice a month. She told me she finally felt safe going to sleep, that she wasn't lying there, wondering if tonight was going to be another scary night. That peace of mind, honestly, was just as valuable as the improvement in her blood pressure numbers. Now, the third position I need to warn you about is sleeping on your stomach, and this is the one that was affecting Margaret, the retired teacher I mentioned earlier. Stomach sleeping is problematic for several reasons, and I want you to understand exactly why, so you can make an informed decision about your own sleep habits. When you sleep on your stomach, you have to turn your head to one side to breathe. This puts your neck in an unnatural position for hours at a time, which can affect the blood vessels and nerves that run through your neck. Some of these blood vessels are directly involved in regulating blood pressure. When they're compressed or twisted, it can interfere with the signals your brain receives about what your blood pressure should be. But that's not all. Stomach sleeping also compresses your chest and restricts your lung expansion. You simply cannot breathe as deeply when you're lying face down. This means less oxygen gets into your blood with each breath, and your heart has to compensate by beating faster and pumping harder. For someone with existing blood pressure issues, this is like asking your heart to run a marathon every single night. I treated a gentleman named William, a 75-year-old retired postal worker from Philadelphia. William had been a stomach sleeper his entire life, and he was adamant that he couldn't fall asleep any other way. He'd tried switching positions before, on the advice of another doctor, but he'd always ended up rolling back onto his stomach during the night. William's blood pressure was dangerously high in the mornings, often reading over 160 systolic, even though his evening readings were usually much better. This pattern told me that something was happening during his sleep that was driving his pressure up. When we talked about his stomach sleeping, William admitted that he often woke up with neck pain and headaches, which he'd always attributed to getting older. We worked together on a gradual transition plan, using pillows strategically placed to prevent him from rolling onto his stomach during the night. It took about 3 weeks before William stopped fighting the pillows in his sleep. But once he adjusted, his morning blood pressure readings dropped by an average of 18 points. He told me the neck pain and headaches had virtually disappeared too, which made sense once his neck was no longer twisted for 8 hours every night. But wait, because if these positions surprised you, the fourth one might really change how you think about sleep. This position is sleeping in a tightly curled fetal position, with your knees pulled all the way up to your chest and your chin tucked down. Now, I want to be clear here. Sleeping on your side with your knees slightly bent is actually one of the positions I'm going to recommend later. The problem is when you curl up too tightly, almost like you're trying to make yourself as small as possible. This extreme curling restricts your diaphragm just like stomach sleeping does. It compresses your abdominal organs. And it can actually impede blood flow to your lower extremities. I see this position most often in patients who are dealing with anxiety or who have chronic pain conditions. The tight curl feels protective, almost comforting, like you're guarding yourself against something. But the physiological effects can be quite negative, especially for blood pressure regulation. Patricia was a 70-year-old retired nurse from Denver who came to me after her husband passed away. She'd been sleeping alone for the first time in 45 years, and she'd developed a habit of curling up as tightly as possible, hugging a pillow where her husband used to sleep. Patricia's blood pressure, which had been well controlled for years, started climbing. She was also experiencing leg cramps and numbness in her feet that hadn't been there before. When we talked about her sleeping position, Patricia broke down crying. She said curling up tight was the only way she could fall asleep since Harold died. It made her feel less alone somehow. My heart went out to her. It really did. But I also knew I needed to help her find a way to feel that comfort without compromising her health. We worked with a sleep specialist and a grief counselor together as a team. Patricia eventually transitioned to a looser side sleeping position with a body pillow that gave her something to hold on to without requiring her to curl up so tightly. Her leg cramps disappeared within 2 weeks, and her blood pressure gradually returned to where it had been before. She told me she'd learned that taking care of her body was a way of honoring Harold's memory, because he would have wanted her to stay healthy. If you've made it this far, I want you to know how much I appreciate your commitment to learning about your health. Please take a moment to like this video if you're finding it valuable. Your engagement helps this information reach more people who need it. Now let's talk about the positions that can actually help your cardiovascular system and promote healthier blood pressure while you sleep. Because I don't just want to tell you what not to do. I want to give you practical solutions you can start using tonight. The first beneficial position is sleeping on your left side with your knees slightly bent. This is often called the recovery position, and there's a reason why medical professionals recommend it for so many situations. When you sleep on your left side, you're working with your body's natural anatomy rather than against it. Remember how I mentioned that your heart is positioned slightly to the left of your chest? When you sleep on your left side, gravity actually helps your heart pump blood more efficiently. Your major blood vessels, including the aorta, which is the main artery leaving your heart, curve to the left and then down through your body. Sleeping on your left side supports this natural flow pattern. There's also a significant benefit for your digestive system. Your stomach and pancreas are positioned so that sleeping on your left side promotes better digestion and helps prevent acid reflux. And if you've ever experienced heartburn during the night, you know how much that can disrupt your sleep and affect how you feel the next day. I had a patient named Thomas, a 73-year-old retired accountant from Seattle, who was dealing with both high blood pressure and persistent acid reflux. Thomas was taking 4 different medications and still struggling to keep both conditions under control. He'd been a back sleeper his whole life and was resistant to change at first. I asked Thomas to try left-side sleeping for just 2 weeks as an experiment. He was skeptical. I could see it in his face, but he agreed because he trusted that I had his best interests at heart. When he came back for his follow-up, Thomas was practically glowing. His reflux episodes had decreased dramatically. He was sleeping through the night for the first time in years, and his blood pressure readings had improved enough that we were able to reduce one of his medications. Thomas told me he felt foolish for not trying this sooner, but I reminded him that we don't know what we don't know. That's why sharing this information is so important to me. The second beneficial position involves elevating your upper body while sleeping, usually by raising the head of your bed by about 6 to 8 inches or using a wedge pillow. This slight incline makes a tremendous difference for blood pressure regulation, especially if you have any tendency toward sleep apnea or snoring. When your upper body is elevated, gravity helps keep your airway open. You're less likely to experience those breathing interruptions that cause stress hormone spikes throughout the night. Your heart doesn't have to work as hard because blood isn't pooling in your upper body the way it does when you're completely flat. I want to tell you about Richard, a 79-year-old retired minister from Atlanta. Richard had been struggling with his blood pressure for over 15 years, and he'd developed a real fear of sleeping because he'd had several episodes of waking up gasping for air. His wife, Mary, was sleeping in a separate room because she was so anxious about his breathing problems. Richard was hesitant about a full sleep study, so we started with a simple intervention: raising the head of his bed using bed risers under the headboard legs. The difference was almost immediate. Richard's episodes of waking up gasping decreased by more than half in the first week. His blood pressure readings stabilized. And after a month, Mary moved back into the bedroom because she finally felt confident that Richard would be okay during the night. Richard told me that simple change gave him back something precious, the feeling of safety in his own bed. He and Mary had been married for 52 years, and sleeping apart had been heartbreaking for both of them. Sometimes the simplest solutions have the most profound effects on quality of life. The third beneficial position is what I call the supported side position, where you use a pillow between your knees while sleeping on your side. This might seem like a small detail, but it has significant effects on your spine alignment, hip comfort, and overall circulation. When you sleep on your side without a pillow between your knees, your top leg tends to roll forward, which twists your spine and pelvis. This twisting can compress blood vessels in your lower back and pelvis, affecting circulation to your lower body. It can also cause hip pain and lower back pain that disrupts your sleep quality, which indirectly affects your blood pressure by preventing you from getting restorative rest. I remember Helen, a 69-year-old retired librarian from Boston, who had chronic hip pain that made it nearly impossible for her to find a comfortable sleeping position. She'd been taking over-the-counter pain medications almost every night just to fall asleep, and her blood pressure had been creeping upward over the past year. When I suggested the pillow between her knees, Helen looked at me like I'd suggested something revolutionary. She couldn't believe no one had mentioned it before. Within a week of using a firm pillow between her knees, Helen's hip pain had decreased enough that she stopped needing the nightly pain medication. Her sleep quality improved dramatically, and over the next few months her blood pressure actually improved as well, because she was finally getting the restorative sleep her body needed. Helen sent me a card a few months later that said, "A $10 pillow changed my life." I keep that card in my desk drawer because it reminds me that sometimes the most effective interventions are the simplest ones. The fourth beneficial position combines several elements we've discussed: left side sleeping with slight elevation and proper pillow support. I call this the optimal cardiovascular rest position, and it's the gold standard I recommend for my patients with blood pressure concerns. Picture this. You're lying on your left side with a good pillow supporting your head and neck in a neutral position. The head of your bed is elevated slightly, either with a wedge pillow or bed risers. You have a pillow between your knees to keep your hips aligned. Your arms are positioned comfortably in front of you, not tucked under your body where they might restrict circulation. In this position, your heart can pump efficiently with gravity's assistance. Your airway stays open. Your spine and hips are properly aligned. Blood flows freely to all parts of your body. Your digestive system works optimally. It's a position that supports virtually every system in your body that affects blood pressure regulation. Now I want to introduce you to George, an 83-year-old World War II veteran from Minneapolis. George had been living with high blood pressure for over 30 years. He'd tried every medication, every diet modification, every lifestyle change his doctors had suggested. He was what we call a treatment-resistant case, and honestly, when he first came to see me, I wasn't sure I'd be able to help him. But George was determined. He told me he had great-grandchildren he wanted to see graduate from high school, and he was willing to try anything. When I explained the optimal cardiovascular rest position to him, George listened carefully, took notes, and asked questions. Then he went home and made it happen. George's wife, Virginia, helped him set up their bedroom for success. They raised the head of the bed with wooden blocks George had in his workshop. They bought new pillows specifically chosen for side sleeping. George practiced the position every night, even when it felt awkward at first. 6 months later, George's blood pressure was the lowest it had been in 20 years. We were actually able to reduce his medication for the first time in over a decade. He told me he wished he'd known about this decades ago, but he was grateful to have found it now. George passed away peacefully in his sleep last year at age 86. But his family told me those last 3 years were some of his happiest, because he finally felt in control of his health. I shared George's story because I want you to understand that it's never too late to make changes that matter. Whether you're 62 or 92, your body can respond to positive changes. You just have to give it the chance. Now, before we wrap up, I want to share some practical tips for transitioning to a healthier sleep position, because I know from experience that changing how you sleep isn't always easy. Most of us have been sleeping a certain way for decades, and our bodies resist change even when that change is good for us. First, be patient with yourself. It takes most people 2 to 4 weeks to adjust to a new sleep position. During that transition period, you might not sleep as well as usual, and that's normal. Your brain and body need time to adapt. Don't give up after a few uncomfortable nights. Second, use pillows strategically. Body pillows, wedge pillows, and knee pillows aren't just comfort items. They're tools that can help train your body to stay in a healthier position throughout the night. Some of my patients put a tennis ball in a sock and pin it to the front of their pajama shirt to prevent themselves from rolling onto their stomach. Third, focus on creating a consistent routine. Go to bed at the same time each night. Set up your pillows in your optimal position before you lie down. Make it as easy as possible to do the right thing. Fourth, talk to your doctor about your sleep position. If you have specific health conditions, there might be additional considerations I haven't covered in this general video. Your personal physician can give you guidance tailored to your individual situation. And finally, remember that improving your sleep position is just one piece of the puzzle. It works best in combination with other healthy habits, taking your medications as prescribed, eating a balanced diet, staying physically active, managing stress, and keeping up with your regular medical appointments. As we come to the end of our time together today, I want you to take a moment and really think about what position you typically sleep in. Are you doing something every night that might be working against your cardiovascular health? The beautiful thing about this information is that you can start making changes tonight. You don't need a prescription. You don't need expensive equipment. You just need awareness and the willingness to try something different. I've been privileged to help thousands of patients over my career, and I can tell you with confidence that small changes, consistently applied, lead to significant improvements over time. The patients I've mentioned today, Margaret, Robert, Dorothy, William, Patricia, Thomas, Richard, Helen, and George, they all made relatively simple changes to their sleep habits. And those changes had real, measurable effects on their blood pressure and their quality of life. You have the power to do the same thing. Your body wants to be healthy. Sometimes it just needs you to give it the right conditions to thrive. I encourage you to talk with your own physician about what you've learned today. Bring up the topic of sleep position at your next appointment. Ask if there are specific recommendations for your individual health situation. Your doctor is your partner in health, and the more informed you are, the better that partnership can work. Thank you so much for spending this time with me today. If you found this video helpful, please give it a thumbs up and share it with someone you care about who might benefit from this information. Subscribe to this channel and hit the notification bell so you'll be the first to know when I post new videos. And please leave a comment below telling me what topic you'd like me to cover next. Take good care of yourself. Your health is worth the effort and you deserve to feel your best at every age. I'll see you in the next video.